Welcome to the Government News Brief for Thursday, February 11, 2016. In the news, government determined to stamp out trafficking in persons, Georgetown Public Hospital to improve its services to the nation, and planned assistance from government to boost local democratic organs' efficiency. With these and other stories, I am Azim Khan. Thank you for staying with us. This is the Government News Brief. Measures to stamp out human trafficking will be aggressively pursued, says the Minister of Social Protection, as the administration hopes to rid society of this scourge. More in this report.
We are serious about TIP in Guyana and will spare no effort to put the critical infrastructure in place to ensure the eventual eradication of the man-made threat, and in the meantime, the severest punishment for all convicted perpetrators, be they female or male.
Minister Lawrence, during her address to the National Assembly last evening, explained that as part of the overall plan to combat TIP, the Counter-Trafficking in Persons Unit will be restructured and transformed into a department. The government intends to approach international agencies to help provide both technical and financial assistance to stamp out human trafficking.
In the quest, sir, we will seek funding to build a home for male TIP victims 18 years and above. To date, we have been able to establish an MOU with an NGO, and we have been able to provide a safe place for our women. And so we want to move on to take care of our men too. This is part of a menu of measures we will pursue this year, 2016.
Currently, there are 4 ongoing TIP matters in the court, and the minister is hopeful that convictions will be secured. With this Government News Brief, I am Shanti Goberdan reporting.
Incoming local councillors should be better able to fulfill their mandates with planned assistance from the government through the Ministry of Communities. Here are the details.
The administration is committed to rebuilding the capacity with local democratic organs. Minister of Communities Ronald Bulkin outlined a number of measures that will be rolled out throughout his ministry during this year.
The Ministry of Communities will follow a policy of collaboration with local and international agencies and groups to achieve the goal of equipping and empowering those organs, Mr. Speaker. One such partnership is with the Canadian-funded Caribbean Local Economic Development Initiative, CARILED. Under this partnership, 6 municipal development plans are being updated, and the new councils, when installed, will be invited to further refine these plans into plans of action for municipal development.
Under the same program, the ministry will also explore with the e-governance unit the option of developing a common information technology platform for financial and administrative management access across the local government organs. As part of the process of empowering the councils, efforts will also be placed on boosting their capacity to collect their share of revenue.
It is no secret that the financial status of our councils is a devastated one. Many are unable to meet their operational costs. This is largely as a result of the fact that property valuations and revaluations have not been done since 1995. Collections rates are low, and the revenue base of councils are restricted. Mr. Speaker, this administration is committed to ensuring that our newly elected councils have adequate financial resources to discharge their responsibility.
Other initiatives that are expected to come on stream to ensure the effective functioning of local government organs include the Sustainable Livelihood and Entrepreneurial Development Program, which is targeted towards developing local democratic areas' economic growth by promoting micro and small-scale enterprises. This will be done amongst the financially disadvantaged.
Hinterland residents to benefit from major infrastructure development roadworks this year. Here are the details.
Hinterland residents will be able to traverse hassle-free this year as several road projects will get underway. These will facilitate greater connectivity between the coastland and the hinterland. During the 2016 National Budget debate on Wednesday, Public Infrastructure Minister David Patterson highlighted some of the developments for the hinterland.
We can keep with our policy of linking the hinterland to the coast, the government has embarked on a program to rehabilitate the major road networks in hinterland regions. These roads are intended to facilitate the access to these areas where our natural resources are located, so as to assist our extractive industry production, which currently contributes significantly to the growth of the economy.
Over $1.7 billion has been provided in 2016 for the continuation of and rehabilitation of hinterland roads in Bartica, Madia, Ituni, Kokwani, and Cassandra Crossing, among others. Over the years, Madia, Lethem, and Bartica have seen an increase in commercial activities and has become a hub for persons traveling via land from Brazil for mining purposes. Hence, the roadwork this year will increase traffic to those areas and boost connectivity between the coast and those areas. For the News Brief, I am Namila Henry Rowe.
Information and Communication Technology (ICT) is being used to help level the playing field for students all across the country. Shanaza Lowe reports on what is being done to improve ICT in the hinterland regions.
Many students in the hinterland have no access to the internet. This places them at a disadvantage when they have to do research and school-based assessments for CSCC exams. It is the intention of the government to change such a situation.
What does the implementation of ICT really mean in a practical sense? It means that our children in Anai, or students attending the Bina Hill Institute, or in Aranapita, for example, must be able to benefit from the knowledge and tuition that the biology teacher at Bishop's High or Queen's College offers.
Additionally, accessibility to ICTs countrywide will have a positive impact on the health of Guyanese. This will be valuable as countless lives can be saved and diagnosis and consultations can be immediately done.
If a medic in Napi, for example, needs the support with a medical issue in his community, he must be able to communicate online with a doctor in Georgetown or any other location close for consultation and related assistance.
Meanwhile, a bill to liberalize the telecommunications sector is with a special select committee in Parliament. It is expected that the bill will be passed this year. With this Government News Brief, I'm Shanaza Lowe reporting.
The Georgetown Public Hospital Corporation is set to offer improved services to Guyanese with a $7.8 billion budgetary allocation. More in this report from Paul McAdam.
There have been continuous complaints of the poor quality of service provided by the Georgetown Public Hospital. These range from long lines to see a doctor, waiting months to have procedures done, and other complaints. Now the government is making a concerted effort to change all of that.
$7.3 billion, which is allocated at a current expenditure, $3 billion is allocated for materials, equipment, pharmaceuticals, and medical supplies, and other consumables. Monies are allotted for the expansion of the renal center. At present, the government spends approximately $11 million annually for dialysis, and this will serve to reduce that amount. We will continue with the expansion of the Industry Health Center and the rehabilitation of the Medical Science Library.
$30 million will also be used to construct a CT scan facility, $15 million for a daycare center, and another $15 million for a canteen. $298 million is earmarked for the purchasing of medical equipment, including $160 million for a 64-slide CT scanner, $20 million for an operating table, $15 million for an anesthetic machine, $21 million for invasive and non-invasive ventilators, and $36 million for neurosurgical equipment. The hospital will also benefit from international stakeholder assistance, such as that from the Inter-American Development Bank.
In the amount of $350,000 to the Ministry of Public Health to aid in addressing key challenges in reducing maternal, infant, and child mortality. Additionally, Mr. Speaker, the Ministry of Finance has requested the preparation of the following loan resources and technical assistance from the IDB. 1. Loan resources in the amount of $5 million to improve maternal, neonatal, child and reproductive health services at the primary as well as the regional hospital level. And 2, technical support in the amount of $1 million for the implementation of projects which will support the response to the suicide epidemic in Guyana.
The Public Health Ministry is aiming to ensure that all persons have access to affordable and quality health care at all state-owned and operated facilities.
We have come to the end of the government news brief for Thursday, February 11, 2016. If you are in this photograph, please give us a call on 226-6715 or 225-3119. We would like to speak with you. The government news brief, along with all other GINA programs, can be found on our website. We are also on Facebook and YouTube. On behalf of all of us here at GINA, thank you for watching.